us. Can you tell our listeners about your background as a nurse and then what really woke you up from, working in a broken system?
Yes, of course. My background is actually nurse anesthesia, and I've worked in both the United States and the Netherlands. During the pandemic, I was actually working in the Netherlands. And just throughout the years, I've realized that some things just weren't making sense. Even with I was thinking about this the other day, even drug reps coming in, for instance, and, trying to sell you anesthesia products for your practice, like those rules were changing. So things have been shifting for a while. During COVID, I think, like many of us, was the big wake up call. I noticed that patients were not being the center of the care anymore. The care model had shifted to some really ridiculous non-science based interventions, and there were non-medical people involved in making decision-making. Where I was locked down for 2 years, off and on for 2 years. Patients weren't able to see their family members, or people dying. The interventions they were using in the hospital system weren't working. Not to mention the isolation gear had really no base science, because as we all know, the virus is actually not contagious after the viral phase is over. When it gets into the inflammation phase, you really are not at risk of spreading it anymore. So just a lot of things weren't making sense. At that time, I became aware of Dr. Pierre Corey and the FLCCC, and kind of transitioned from the clinical setting to working with them, helping them spread their mission, and just helping support literally millions of people all over the world with simple, logical treatment strategies. Repurposed drugs was a foundation of those, along with just sunlight, hydration, nutraceuticals, healthy diet, all those kind of normal things. So that was kind of my stepping stone out of the clinical setting. In addition to that, in my background, I am a yoga teacher. So yoga has always been a part of my life. And so having a mindfulness, growth mindset, and having a connection to a higher purpose, and having a regular daily practice has also been instrumental in me kind of seeing through all of the stuff that didn't make sense. And now to this day, all of those things have just kind of come into synergy. And now this new brand that I'm building, Get Healthy or Get Dead, is just like a conglomeration of health promotion, common sense things, cutting through all the BS they're trying to sell you on both sides of the coin, and prioritizing simple things like movement, hydration, health, and just basically taking control of your own responsibility for becoming a healthy person.